Hi guys, my name is Shauna and I have Chiari Malformation type 1 along with a bunch of other conditions that came along with it as well, or stemming from it, who really will ever know. So I just wanted to get on here and talk about the things that are important to rule in or out if you've been diagnosed with Chiari Malformation. A lot of the time it can, not always, but a lot of the time it can come from several different things, and it can be acquired or congenital. I'm going to repeat that again. It could be acquired or congenital, born with or acquired later on in life or caused by something else. It's super important because people's lives are being So I have no idea where I was. My husband just called me. I'm gonna go back to where I thought I was talking about. So yeah, acquired and Chiari malformation is completely different, and then true Chiari malformation is just Chiari malformation. Acquired is, it's a whole different story. So things that can cause an acquired Chiari malformation, it can be from Ehlers-Danlos syndrome because it's a collagen disorder. Your brain is tissue, and it can kind of just drop over time. And then a CSF leak, which is, it can be a leak in your dura, which is the protective layer that comes around your brain and down your spine. It protects your spine, and you can have a tear in it, and CSF fluid can be leaking out of it, which makes the brain not anymore have that fluid that's usually your brain's supposed to be floating, and if that fluid is leaking out, it's dropping down and it's not floating anymore, which can cause a acquired Chiari malformation, which is a completely different treatment than a true Chiari malformation decompression surgery. You can have a CSF leak that's causing your brain to drop down like that, and you can go and get different treatments, whether it be a blind blood patch, sometimes is all that's needed, a targeted blood patch, which is basically where they take your blood and seal it with your own blood. Totally different than a brain surgery, and so who would want to go through a brain surgery if they don't need to? And also you're going to come out a lot worse because you didn't need that brain surgery, and you're still not going to be better. So yeah, things like that. It's just super important to know what to rule in and out when you have been diagnosed with Chiari, because no radiologist is going to give you this information, and it can really change your life. I'm going to say right now, though, that not everybody has the means to travel in a PPO insurance plan. So this isn't for everybody, and I don't want to upset anybody by that because my heart is with you. I've been through some struggles myself. I do have a husband that got a job that got a PPO plan for me, so I'm super grateful, but I know that that is not the case for many people. So if you do have the means, then this video is definitely for you, and if you don't, hopefully you can still fight through and find a way, but so that's that. But if you've been diagnosed with Chiari malformation, it's also important. Some people can get away with getting the brain surgery and being better, and not much research into it, not ruling out EDS, CCI, intracranial hypotension, hypo or hyper, they're different, and so many other things. But it's so important to do that because you could be that person that doesn't rule it out, goes and gets a surgery done by somebody that only does Chiari decompressions, doesn't know anything about your EDS that's underlying, which could be part of the cause, or could lead you to an unsuccessful surgery. Because for me, I was diagnosed, it took me so many surgeons that told me, no, you don't have EDS, no. They would laugh in my face. I'm not going to doctor bash, but it was really hard, because I felt like I had the signs of certain things after doing all my research, and it turns out I did have EDS. I had POTS, I had mast cell activation disorder, MCAS for short, and that affects the surgeon that I would pick dramatically. It could change my life if I got surgery by somebody who didn't know about those things and how to go about it, because a lot of the times when you have Chiari and you have EDS or CCI along with it, you will not come out better after. Sometimes most people need to be fused at the same time that they get their decompression surgery, which is basically, fusing your C1 to your skull and then also doing your decompression surgery. So they don't all the time do that. For me, I do have CCI, but not severe. We're going to wait and see. We're going to do my decompression and then see what happens. Sometimes you can develop that instability later and they realize, okay, yeah, the CCI is playing a part in this as well. So, I felt like I had to get the answers before I could go forward with this surgery. I had to rule out freaking everything, and it was torture as hell, literally living through dealing with all that and the appointments and the traveling and the different states I've had to go to, people and family judging you, thinking, look, they're telling you that you just need this surgery, like, just do it. I knew what I needed to do because I did the research, and I have been through the days of excruciating pain and studying, on my deathbed. And so I feel like it's so important because I learned all these things and from reputable sites. You can get on Google and research or look up just Chiari Malformation, and it's going to tell you it's going to tell you a little bit about Chiari, but it's really not going to tell you how far this Chiari actually goes and that people's lives are being destroyed. It's not going to give you the information you're looking for. You need to find the people and that have been through it. So that's what I did. I got on Facebook groups, and then from there I found the sites that I needed to go and learn everything about, which was the most massive amount of information. And, I will also say that I was diagnosed with tethered cord after 4 years of my first initial diagnosis with Chiari, and all the doctors, which is probably, maybe 20 to 30 doctors and surgeons told me, no, you don't have it. And I just had an appointment in Rhode Island, and it turns out I have tethered cord, which can also cause an acquired Chiari, or can just come along with it. It basically can pull down on your brainstem and pulling that, your cerebellum, which is the bottom part of your brain, down. Or like I said, it can just come along with it to where you have both underlying. And so you may need to get the detethering surgery first, usually. She doesn't want to do that with me because I'm not having symptoms of tethered cord that are bothering me at the moment. That could change at any time, but sometimes all people need is a detethering, and it kind of lets that, spinal cord from tugging down, and it releases it, and your brain can start floating back up to where it's supposed to go. And hopefully you don't need the decompression surgery as well. So there's just so much to it, and I highly, highly recommend doing your research, which, is, like I said, a very hard struggle to have to go through when you're in so much pain, but it's vital to a lot of us. So I just want to say how important it is. And I feel really good going into this surgery. Well, I don't feel good because I don't want this surgery, if I'm being honest, but I feel like I've done the research and I've really ruled in everything and out everything that I could, and I know what is going on with my body and what to look for after my surgery. If, something were to go wrong, I kind of know where to go after that. So I feel really good about that, and I feel good telling you about it too, because I know many people through all these different spider webs of things that had different, things happen, like the CSF leak. One girl had the Chiari, she had a blood patch done, and her Chiari got better, and her life got better by like 80%. I mean, God, if that's all it took for somebody, then I want to be somebody that can, tell you about that information. For me, that's not the case, but I think it could change somebody's life. And not everybody knows of that. And I see so many people saying, oh, my surgery failed. I wish I would have known what to look for. So this is just one of the messages. I hope it helps somebody and reaches somebody. And I'm here to chat if anybody. I hope that I could use my knowledge to help somebody. Have a good